Indiana just passed a bill described as a medical spa safety measure, but when you look closely, the story becomes much more complicated, because SB 282 may not actually be about med spa safety at all. Instead, it may be about the rapidly growing GLP-1 market and who controls it. If you're a medical spa professional, a prescriber, or anyone following the GLP-1 space, here's what you need to know. The Indiana Senate recently passed Senate Bill 282 with little debate and minimal input from the medical spa community. After reviewing the bill and working with Indiana providers, AmSpa formally opposed the legislation due to vague language, lack of industry involvement, and concerns about its real impact on patient care and providers. As we dug deeper, a bigger picture emerged, one that extends beyond Indiana med spas, and it all revolves around the use of GLP-1s. Originally prescribed for the treatment of diabetes, GLP-1 medications like Ozempic and Wegovy are of course now known more for their off-label usage as weight loss drugs. A recent World Health memo officially gave approval to this practice, and the peptide space is rapidly evolving. So it's important to note that it has quickly become one of the most profitable pharmaceutical markets in recent history. Medical spas and physician practices have responded to this demand by offering personalized treatment approaches, sometimes including compounded GLP-1 medications prescribed through licensed compounding pharmacies, which is legal when done in compliance with FDA regulations. Patients value the customization, and providers value flexibility in dosing and delivery. But pharmaceutical manufacturers have consistently opposed expanded use of compounded GLP-1 medications because lawful compounding reduces their market share. And that is how we find ourselves back in Indiana. At AmSpa, we believe that there should be high standards for professionalism and patient safety when it comes to owning a medical spa. We are proud to have been able to provide practitioner-focused input on several similar bills. If a bill is truly about medical spa safety, we believe that it should address the industry's known challenges: untrained or unsupervised providers, improper ownership structures, counterfeit products, or inconsistent enforcement. SB 282 does not meaningfully address any of these issues. Instead, many of its safety provisions simply restate requirements that already exist in Indiana law, without adding clarity or enforcement mechanisms. In other words, it's a bill that adds complexity without solving any core problems. We believe it may have a different goal instead. SB 282 creates a public registration system requiring practices to report services they provide, medications they prescribe, compounded medications they use, and practitioner licensing information. The bill also defines medical spas so broadly that it could include many other types of medical practices, from family medicine to dermatology to OBGYNs. This creates a public tracking system for prescribing activity, particularly related to compounded medications. This system would add practical challenges that go unaddressed by the bill's writers. How would new therapies be registered? What about off-label treatments? Could clinics face fines for administrative issues rather than safety concerns? The lack of clarity on these and other processes required by the bill is revealing of its purpose: to create more obstacles for providers wishing to provide compounded GLP-1 medication to their patients. Because safely and legally compounded GLP-1 cuts into the profits of a major manufacturer. The most important thing to know about SB 282 is that it is strongly supported by Eli Lilly, the Indianapolis-based pharmaceutical manufacturer behind GLP-1 medications like Mounjaro and Zepbound. For all their success and despite their wide-ranging portfolio of brand names, Eli Lilly is not a big player in the med spa space, so their involvement with this bill speaks more to a desire to monitor the usage of compounded peptides. AmSpa supports innovation, patient safety, and responsible regulation. When it comes to common-sense safe operations, we say compliance is cool. But regulation of medical practice should not be driven by pharmaceutical market competition. A bill that introduces rules and procedures for medical spas should include the input of med spa professionals, not patent holders. Without meaningful industry involvement, legislation risks serving commercial interests more than patient care. Providers across Indiana have expressed frustration with bad actors in the industry, and that concern is valid. Guidelines and laws can limit fly-by-night operations and the danger of procedures by unprepared injectors. But once laws like this are passed, they are extremely difficult to change. That's why it's important to make sure they are written, debated, and passed in good faith. If you're in Indiana or anywhere in the medical aesthetics industry, now's the time to stay informed and engaged. Here's how you can help. Share this information with your colleagues and professional network. Reach out to legislators to ask questions about SB 282. Join AmSpa to stay informed about legal and regulatory developments affecting your practice. Because the future of medical aesthetics should be shaped by providers, patients, and safety, not market competition. And AmSpa will continue to advocate for smart, effective regulation that strengthens our industry. For more information, you can visit AmericanMedSpa.org.